one. Which is the most adorable, cutest feature of a child? It's a smile. Especially when the cummy smile changes into a toothy grin. However, behind this cute little smile is a lot of distress and difficulty when the teeth are coming in. So this is Dr. Supriya Patil Ganeshwade talking today on teething. Teething is a process wherein the teeth come out into the mouth through the gums. It's a very painful process both for the child as well as the parent. Teething usually begin anywhere between 4 to 7 months of age. However, there are some babies who do not teeth even until they are 1 year old. Even until their first birthday, they do not teeth. This is absolutely normal and should not be a cause of concern. Usually, the lower front two teeth erupt first. However, there could be variations to this too. Instead of the lower front teeth, the upper front teeth might as well come earlier before the lower front teeth. So this again is a normal variation and you should not get worried about it. What are the signs of teething? How do you know that your baby is teething? First and foremost, the child may become very fussy and irritable. He may have difficulty falling off asleep and staying asleep. He may have lack of appetite and therefore he may not feed well. And this makes him more cranky and fussy. You may see that the gums are slightly swollen and painful when you touch. There could be a sudden increase in drooling of saliva. See, usually babies do salivate a lot. There's usually a lot of drooling. That's because the salivary glands have started to function normally. However, if there is a sudden increase in excessive drooling of saliva, sudden increase in the salivation, that means the child may be teething. And this usually lasts for around 3 to 4 days. So excessive drooling of saliva is another sign of teething. And because there is excessive drooling of saliva, there could be rashes around the mouth. So this again is one more sign of teething. Now, when a baby is teething, he has a tendency to take up things and put it into his mouth and chew over it. This the baby does to get relief from that constant aching gums. So this process is called mouthing. So a child picking up things and putting everything in the mouth. Usually it's the toys, the clothes, even the parents' fingers. Just grab it and put it in the mouth. So this could be a sign of teething. However, mouthing is actually a very normal developmental process wherein the child is exploring the world around him. So every time mouthing doesn't indicate teething. So mouthing, excessive mouthing only for 3 to 4 days could be a sign of teething. Owing to mouthing, the child may have fever, diarrhea, vomiting. Now there is a myth that teething causes fever, diarrhea and vomiting. But it is not teething per se that causes it. It is the mouthing that causes fever and vomiting. That's because when the baby is putting things into his mouth, there is an ingestion of microbes entering into the body. And because of these microbes, there could be some kind of infection leading to fever, vomiting and diarrhea. So remember that whenever your child has these symptoms of fever, diarrhea, vomiting, it's not because of teething, but it's because of some kind of infection, and therefore it is necessary that you visit your pediatrician for the same. How will you help your child in decreasing the pain, decreasing the discomfort of teething? There are 3 things that you must do. First is take a cold, clean washcloth and apply a little bit of pressure or rub the area. The cold cloth will numb the area and it would provide some relief to the baby. Applying pressure will relieve the pain of the aching gums. When the gums are achy, the child tends to bite over it, bite over the gums, bite over any object so as to relieve the pain. So what you can do is take a clean washcloth and apply some pressure over it or rub the gums. You could also use a cold spoon. The back of the spoon, just place it over the gums and apply some pressure. Third, you can contact your dentist, and if the baby is really very painful, the baby is really very fussy, your dentist may prescribe some painkillers to get relief from the pain. These are the 3 things that you must do. You can also use teethers, but be aware of which kind of teethers you would use. Please watch my next video on teethers, on the different kind of teethers and which one is the safest to use. These are the 3 things that you must be doing. Now, what are the things that you must not be doing? Most of the parents give cucumber or carrots to bite over. But this is really hazardous because the cucumber or carrot pieces can choke up the child. So never give things that could break off, never give edible things that could choke up the child. There are some over-the-counter teething gels. Okay, these teething gels have benzocaine, which usually numb the area. But do not use them because this ingredient, benzocaine, has it causes a very serious and a very rare but very serious condition called methemoglobinemia. Now, in this condition, the oxygen carrying capacity decreases and therefore the baby can become breathless. The baby may become bluish grey in color, indicating that there is less of oxygen supplying to all the body parts. So these are the signs, and therefore over-the-counter teething gels should not be used. Please avoid them. You can always go to your dentist or pediatrician who will give you the painkillers necessary to relieve the pain. Take care of the do's and don'ts during teething. Follow the tips given to you. And do watch my next video on teethers. Which teethers should be used, which are harmful and which are beneficial. Thank you and keep smiling.